Welcome everybody to Dr Moncrieff's Facebook Live for Plastic Surgery Hub. I'm obviously Dr Nick Moncrieff. This is my beautiful wife, Amber Moncrieff. And so this is going to be a great session on combining breast and body surgery. This is what we do a lot at Hutter Plastic Surgery. And so I just want to welcome everyone on board, and hopefully the session will be informative and you can ask lots of questions.
Yeah, so thanks everyone for joining us tonight. While we're sort of waiting for everyone to jump on, just keep in mind there's about a 15-second delay on Facebook Live. So sometimes you'll sort of write something, it might just take us a sec to respond. But we just thought to start with, while everyone's jumping on, we might do a bit of a funny kind of guessing game.
Yeah.
And so the game is to guess how much skin and tissue and fat Dr Moncrieff liposucked and cut off patients last year.
Last year, yes.
So it's a large number. Just to give you a couple of hints. So about how many tummy tuck and reduction patients did you do combined last year?
So I think there's about 170 to 200 patients. So, you know, there's quite a lot of patients. So, and if you think about over a year, there's quite a lot of tissue, but get your pens out and see if you can have a stab at the number of kilos that we remove, because I think you'll be surprised just how much tissue, you know, you do remove in these combined cases.
Yeah, so it's certainly a lot of tissue that's come off. So yeah, we can see some people are joining, and hopefully it's all coming through clearly to the website or to the Facebook group. So we might just wait and see.
There's a few more people.
Yeah. So I guess the other thing that we'd be really interested to know is, you know, from your perspective, the reason that you've joined us tonight. So, you know, when we talked about doing this with Trish, we talked about doing combined breast and body surgery. Yep. But really, what is the reason that you've joined us tonight? So if you want to write that down, hi, Brianna, and Jess, who is our practice manager, no, she cannot guess. She knows the answer. We discussed that at our team meeting today.
It's probably people who do not know practice, because otherwise it's unfair.
Oh, so Susie's saying that she can hear us, see us, but can't hear us. Is anyone else having any problems
with the audio?
With hearing us? So Jess, are you able to hear us? Okay, so Susie, that might. You might just want to just double check your audio.
Yep.
As I say, sorry, there is about a 15-second delay on these things. So sometimes you'll be sending us messages and we won't necessarily be seeing it straight away. So yeah, so lots of people are saying different things here. So people having surgery coming up. Yeah, so different people are saying, yes, I can hear. Yep, great. I can hear. Yeah, audio's fine. Beautiful. Okay. So did anyone have a guess about how much tissue? So Dr Moncrieff, do you want to reveal the answer?
Okay, so I think you guys need to be sitting down when you hear this number, but it is 431 kilos. So almost half a ton of skin and fat that I removed last year from our breast and body patients. And so I think you'll be surprised that, you know, in that breast and body practice that I have, and which I love having, you know, we go to a lot of efforts to get the tissue off, and it just goes to show that this surgery is becoming more and more prevalent, and more people are wanting these sort of surgeries. Okay. Excellent.
All right, so we might kick off. So we'll just skip through.
Yep.
So in terms of the reasons that most of the patients come to our practice, what are the main reasons?
So I have to say the number one reason that people come to Hutter Plastic Surgery, and I'm sure a lot of you, the other plastic surgeons around Australia, is babies. So pregnancy and childbirth has profound effects on women's bodies, and it is the single probably biggest reason why people come in wanting to restore a shape and volume after pregnancy, probably closely followed by weight loss, and often they're combined. So weight loss is becoming more and more of a good reason for people to have these surgeries, and obviously the combination of the two does lead to, you know, big changes, especially in the breasts, in the abdomen, and so we do a lot of this surgery on the basis of those two reasons alone.
Being a mum of three, I've experienced highs and lows of weight gain and the results of that. So yeah, I guess we understand a lot about those sort of patients. We also see lots of patients that are weight loss that haven't yet had children.
Yes, so, and that's an important thing to address as well.
Yeah, so we'll give you some examples of that tonight. So really what we want to do is help you understand more about combining breast and body surgery tonight. And no matter who you choose, but to give you enough information so that you're asking the right questions, so you're making a good choice if you're going down that path and, you know, ready to sort of experience that journey. So that's our goal for tonight. So what we'll do, we'll talk a little bit more about the breast and body operations. We won't go into a whole lot of detail about each of the individual operations, because we sort of covered that, I think, in our last Facebook Live. You sort of covered a lot of that stuff, but really combining them. And the way that we'll show you is case studies, so actual women that have had surgery. So if you didn't see the link that Trish and I posted about an hour or so ago, if you do have another device handy, get onto the hunterplasticsurgery.com.au website and go to the news tab. And the reason that you want to do that is I've actually put up the case studies on a news page there. So you go to the website, up the top there'll be news, and you click on news, and this is what you'll see. And so what that'll do is it just means that some of the case studies and things that we're going to talk about tonight, you'll be able to see in high res. So if you have another device, do it, because if you try and cross between tabs, I think it'll close this Facebook Live. But if you don't, that's fine. They will be up there afterwards, and we're going to hold them up, obviously, so you can have a look, but just makes it easier if you want them in high res. So so we're going to talk about that. We'll talk about some of the physical benefits of these operations, so it's not just cosmetic. We'll talk about the risks, the costs. So I know that is a really hot topic for people, but trying to understand a little bit more. It is very easy to say, oh, I was only charged so-and-so for so much for this at this clinic, and I was charged this at this clinic, but are you really comparing apples with apples? So we're going to talk a little bit about what costs are. Travelling for surgery. So, you know, we are seeing patients now from all around Australia.
Yeah, and we love seeing people from all over the country, you know, and it's great to be, you know, recognised, and we really take our time in speaking to those interstate patients because it's important, I think, to see them in person before you embark on any surgical journey.
And we know that a number of them are on this forum, so so thank you for your support. And then we'll talk about frequently asked questions that were asked by patients all the time and that I know are asked on this forum, as well as some of the specific questions that you submitted to Trish and to Christy beforehand. So we'll try and get through those, and then we'll just give you a little insight into our Vectra surgery simulations. So obviously this is a service that we have and we love it. There are these Vectra machines all around the country. Lots of good plastic surgeons have them. So at least if you've had a look at what it looks like here, and you're going somewhere else for one, you'll have a little bit of an insight into it. So just make sure there's nothing. Okay, so some of those issues we'll try and address just towards the end. So hopefully we'll cover some of these things. So as I say, if you've got access to another device and you can jump onto the Hunter Plastic Surgery website under the news tab, you'll see the case studies for tonight. All right, so let's have a look at some of those surgical solutions. So the things that people are here to hear all about.
Yes.
How do you do all those surgeries, Dr Moncrieff?
Well, that's a really good question. So the best thing for everyone is really to go to our website, and the website has some great 3D animations, and I hope everyone's been to see these, because they really are very good. Without all the blood and guts and gore, you can see these procedures, which are really quite detailed and very quite close to how we actually do them. You can see the breast implant surgery. We use only silicone breast implants there. Incisions made beneath the breast with the tummy tuck. That is a good illustration of how the muscles are repaired in the tummy tuck, and then where the incision is. And then with the breast reduction, you can see the scar pattern, which is really underneath the breast, scar which goes centrally up the middle of the breast and then around the nipple. So you can get an idea of where the scar placement is for all these surgeries. And look, really spend your time and looking at that, because it really does provide a lot of good information for those people who are not sure how these surgeries happen.
Yeah, I will just say on that, they are American. There's great things about America, but there's some things that probably we don't do in our practice. So just be aware of that. So particularly with the breast implants, underneath the breast, not through the nipple or the armpit, and what type of implant.
Yeah, and only silicone breast prostheses. We don't use saline because of the risk of rupture, and they just do not hold the shape as well. But look, you know, that's another conversation. But those are the really major differences. But you know, breast reduction is very similar to the way I do it is what's in the video, and also the tummy tuck again is quite close. So it is quite helpful for people wanting to gain extra knowledge on these procedures.
Yeah, definitely have a look at those. So what we're sort of asked to concentrate on, though, is trying to combine surgery.
Yes.
So, you know, the patients that we're going to talk to you about tonight are people that have combined abdominal surgery with breast surgery.
Yep.
So on the day, what actually happens?
So this is a really great question. So the patient will come into the hospital. I'll spend probably 10 or 15 minutes doing the markings. Then the patient will be brought into the theatre that we put to sleep like a proper general anaesthetic. And then we'll prep and drape the patient, and we'll start with the liposuction first. So liposuction usually takes somewhere between an hour and 2 hours, depending on the size of the patient. And we do all of that first. And I really spend a lot of time in getting the lipo right, because that is the key to getting really good body transformations in combined mummy makeover surgery. Then I'll do the breast surgery, whether it would be a breast reduction or a breast augmentation, and then go on to complete the tummy tuck or the abdominoplasty surgery by removing excess skin and tightening the muscles. So that's the sequence. Then the patient will wake up and go to recovery and recover there on the ward for a few days after that.
So on average, how long are they in theatre for?
Yeah, so it's about 7 to 8 hours. So really, basically we spend all day with these patients. We take our time. We don't rush it. We don't tend to put other patients on, so we can really concentrate solely on those people.
Yeah, and some of the big differentiator there is often the time spent doing liposuction. Obviously, for a very petite patient, that won't be the focus, but certainly for sort of larger women, women that are mass weight loss, that is what really, those results that you see on this forum, the MoncrieffMagic results, are hours spent lipo.
It is, and if you're not doing that, because you just cannot get the shape change, you can't get the profiles, you can't do a lot of the stuff, and lipo is really a big advance, I think, in these mummy makeover surgery, and something that I think all of us should be doing to get the best possible result.
Yeah, so what we'll do now is we'll switch to some of those case studies. So if you do have the website open, that's a good opportunity to, on another device, just to flip open to those ones. And we'll just talk to them. We'll still show it on the screen, but if you want that really higher resolution and you really want to get to the nub of these things, we tried to do different ages, mums and not mums, and different procedures and different body types. So hopefully there's something here for everyone. All right. So patient A, what have we done here?
Okay, so this is a 34-year-old woman, as you can see. She's had 4 children. I think you can see, certainly from in terms of the breast are a little bit lax, a little bit droopy. Nipples are in the right spot, but she hasn't got a lot of what we call upper pole fullness or cleavage. And in the abdomen, you can see a lot of loose skin around, certainly around the navel, and you can see this sort of protuberant sort of like abdomen, and it looks like she's got a sort of a 3 to 6 month pregnancy going on there. So she's really got wide separation of the muscles. So we've gone on to do a scarless lift. So we've got lift out of the implant alone by incision just at the base of the breast, creating cleavage, side boob, and upper pole fullness. And we've gone on to really tighten those muscles and remove that excess skin, doing this a really tight abdominoplasty and really really improving her shape and giving her back what children and pregnancy took away.
And so that was done as one stage?
One stage, 4 hours.
And so no lift, no scars?
No scars, no. We've managed to do that with a shape or an anatomical implant, which generated a lift, and all done, 4 hours, way to go, that's it.
Yeah, so that's a good example. I was talking before about patients that don't necessarily need a lot of liposuction. So that is a patient, very low BMI. Really, that focus is on the skin removal and the abdominal tightening, as well as the org. So what about this lady?
So again, a different lady, lady of 40. She's had 6 kids, and you might go, oh God, but anyway, people do have lots of children.
So other people.
But she's got she's had an emergency surgery on her abdomen. You can see the scars there. So what we've managed to do is, and also breasts that have dropped and are a bit lax, certainly from breastfeeding 6 children. And we've gone on to then do a breast reduction and lift, and you can see restoring shape and volume to the breasts, as well as doing lots of liposuction and doing a tummy tuck, and we've tightened the muscles. We've got rid of all of that scar tissue from below the navel, and we've recreated her waistline and given a really nice abdominal profile.
Excellent. So again, if a lady like that wanted an augmentation down the track, would you have done it at the same time?
Definitely not. It's just too much to do in one go. You really want to get the nipple back to where it needs to be in the first operation and remove that excess skin from the bottom of the breast. And I like to do these operations generally in 2 operations spaced by about 6 months.
All right. So this is, who's this lovely lady?
So this is Kylie. She's one of our very lovely mass weight loss patients. And I did surgery on her in 2017. We did a tummy tuck and a thigh lift, and she liked it so much she became a receptionist for us in the last year. And I hope you can see there with the excess skin and stretch marks from the weight loss on the left, and then on the right you can see much improved abdominal profile, nice new navel, and we've really sculpted along the sides and along the flanks to give it that nice shape, as well as removing that excess skin in the inner thigh region and making that nice and tight and trim.
We'll show you that other angle, and we'll talk about some of the challenges now combining thigh lifts with abdominoplasty as we go along. But again, just to show you the
three-quarter view does show quite nicely. Now, you've really got that nice sort of sculpted looking abdomen, where before you had excess skin and fat hanging down, and it was rubbing on her skins, as rubbing it on her knicker line. Now it's all been removed, but there's been a lot of lipo. About 8 kilos has been removed off her in that one sitting. So it's an all-day affair.
All right, so that was stage 1. Stage 2, so separated by at least 6 months, is our recommendation.
Yep, and so she's gone on to have, as you can see from the weight loss, she's got lots of lax, loose skin at the bottom of the breast. The breast has dropped, and now we've done a breast lift and moved the nipple into a high position, got the breast off the abdomen and back onto the chest wall. And then at the same time, we've done a bilateral arm reduction to remove the excess skin out of her arms.
So a lot of people are asking now about lifts, just standalone lifts rather than with an implant. Do you do them?
Yes, so we do lots and lots and lots of lifts. Now it's becoming, I think, a lot more popular. Certainly people just want to have that skin removed off their abdomen, their upper abdomen. They don't want the rubbing, they don't want the rashes, they don't want all the hygiene issues that go with that. And getting those breasts back off the abdomen onto the chest does a lot for women. And a lot of people, who think they might need an implant, in fact, they don't. They just want to have that skin removed and the nipple moved higher, and are often very happy with that. So that's a really, really popular choice, and one we're seeing more and more of.
We do have a number of questions there. We will try and get to them at the end. So someone has said, notice that there's no fleur-de-lis tummy tucks. Do you get the same results?
Yes, we do. We do a lot of them because, obviously we're fleur-de-lis combining the traditional abdominoplasty with a vertical incision, and we do that to narrow the overall diameter of the breast, especially if there's tissue off the sides along the abdomen. Yeah. So we remove that tissue with a vertical line, and we don't post them all the time, but we still do lots of them. And look, they are very, very tight and very, very trim because we do lots of lipo with these patients.
Yeah, so they're the very sort of mass weight loss patients. We do find normal sort of tummy tucks. I mean, most of them don't want that scar.
Yes, no, you've got to really need that that scar, I think. And if you can get away with it, obviously it's great. But obviously, people losing more than 50 kilos are often needing that extra incision to reduce the overall amount of skin.
Just zip back to the lift of Kylie, sorry, just always trying to get it in the right spot. So, so that's just that three-quarter angle as well. All right, so, and what about Emma?
So Emma is another patient of ours, another weight loss patient of ours. She had lost about 40 kilos, I think, from the old-fashioned way of diet and exercise. So she's been congratulated for that. And basically here she is before and has gone on to have a tummy tuck, lots of liposuction, and a unilateral breast lift and implant, and an implant on the other side. And you can see the great change in her abdominal profile, silhouette, and your nice navel. And so it just goes to show that weight loss affects people with children and without children, and she feels a lot more confident now that she's got all that excess skin removed and got her breasts being nice and fuller, and again back off the abdomen, sitting where they should be on the chest wall.
Yeah, so Emma is a lady that I think it was maybe 50 plus kilos lost, but she hasn't yet had children. She does want children. So how long would you say, if someone this is we get all the time. So if someone's looking at breast surgery and they haven't had kids, or they're thinking about more kids, how long would you say?
I would say, look, if you're thinking about having kids within a year, I would say don't do it, you know, really. But if it's anything time longer than that, you should really go ahead and do the breast surgery. With a tummy tuck, I think if you're thinking having kids in the next 3 to 5 years, I think would delay it because it will change. It will change everything. Pregnancy changes everything, and we see it time and time again. So if it's something you're thinking about, I think would say put it off. But if it's something not on your horizon in the near future, I think you can perform both.
And the great thing is, amongst our team, we actually have patients that have had surgery with Dr Moncrieff and then started to work for us that are in both situations, so pre-children and after children.
Yep.
So that's great. So you can sort of talk to them about their experience as well. So, all right, so another, just the other angle there for Emma.
And you can see, you know, the now that really nice curve in the upper part of the top of the breast and that nice underboob. It's now been lifted by the implant and yeah, much better shape, and you can see the overall taut sort of abdomen in that side shot.
And all of these cases where you've used a breast augmentation, what shape are you using? What?
Tend to use anatomical or the teardrop shape implant. I just like the lift that you can get from them. You know, people do use round implants very well. It's not something I use generally. I just like what the shaped implants can do. You have to be a bit more technique focused, I guess. You have to make the pockets really tight because there is a risk that they can rotate. But if you know how to use them, I think they, for me anyway, in my hands, give me better results.
Yeah, certainly for that patient looking for any sort of lift and a natural sort of looking cleavage. So that was just a lovely photo of Emma. So she came in recently and did that photo with us, and I think it just shows the confidence that she's got. So the other really hot topic is 1-stage versus 2-stage lift and augment. So do you do 1-stages?
Yes, so we get this asked, right? And yes, obviously we do 1-stages, but for me, the selection criteria for those procedures is quite strict, and I like to do it in patients where the nipple movement is not going to be too drastic, where the nipple doesn't have to move up too far. People who are not generally weight loss, and people who do not want to go too big. In those instances, I will combine it and do it in one operation. And
so let's talk about an example of that. So where you can see, there we go. So this is a lady that you have done it in 1 stage.
Then you can see a pretty nice result. You can see the nipples been lifted. We've got a lot of that excess skin. We've lifted the boob, the breast off the abdomen with the implant and placed the nipple higher. And that, I think, is a very acceptable result using 1 stage. But more and more with people with lots of weight loss, lots of children who are wanting bigger than just a modest size implant, I think they will definitely do better with 2-stage.
Here's an example of one of those sorts of patients.
Yep. So this is a slightly old lady. She's 45. She's low-breasted. That means the breast is attaching low in the chest wall. The nipples are at the bottom of the breast. There's lots of laxity, as you can see, in the bottom of the breast. She's gone on to have the lift, and then she's gone on to have the lift, and you can't see that photo, but then have the implant, and here she is now, much fuller looking breasts. The breasts are starting a lot higher on the chest wall. The scars are almost non-existent, and you know, you've really changed this lady's breastedness. Basically, she's now a lot fuller and higher, whereas before the breasts are sort of empty and deflated.
Yeah, so I think, you know, from some of the results that I see out there, where they have done them in 1 stage and they've tried to do a larger implant, what you see is really pronounced scars. Now, lots of patients do tell us they don't care about the scars, but then others tell us that that is the #1 most important thing. So that's the benefit of the 2-stage.
This 2-stage really does reduce the scar burden, because we don't do that second operation until the scars are gone white. And that when the scars are going white, they don't tend to stretch, and you don't get to see these big, you know, areoli, which we see often when 1 stage, because the pressure from the implant behind it tends to stretch out all the scars, the vertical, the one underneath the breast, and also the one around the nipple. And that's what I think is you know, sometimes the telltale signs of some average surgery, when that scar starts to stretch because the pressure of the implant behind it.
And so the scars don't look good, but also in terms of wound breakdown.
Yeah, and you know, the wounds can break down. They can be infections. They can lose implants. We see it, you know, not uncommonly that people can get into trouble with these, with big implants in a 1-stage augmentation uplift.
So, Dr Moncrieff, you actually wrote an article about
this. Yes,
recently on the website.
Yep.
So we have put the link on the page on the website. All this stuff on the Special Plastic Surgery Hub Facebook Live posts. So if you go to the news tab on the website, you'll also see the link to this one, which is, you know, do I need a lift or implants or both? And if it is going to be both, then do I have it as a 1 or 2 stage? So I definitely check that out if you're not quite sure about why your surgeon's recommending it. I know that it's a bit of a hot topic, but that helps to explain it.
Yeah.
So, and of course, there's lots of other examples on this group. So I'm just going to show a couple of examples there, but there's some of our patients who have been posting their results. You'll see there we have to block out what their actual comments are. It is illegal for us to post testimonials from patients. However, if patients are posting it themselves and we have no control over it, well then that's a great sort of testament to how strongly they feel about their results. And I'd also say that, you know, when you're looking at patient reviews or anything like that, the more detailed they are, if they come with before and after photos, that's where, you know, you can really tell. I think otherwise,
that's
you know,
authentic person giving a pretty accurate description of their experience, and hopefully with some before and afters, because nothing tells a picture like nothing tells a story like, you know, pictures.
And then of course you can also just search for the hashtag moncrieffmagic, particularly for augmentation patients, but some of our patients that are reductions in tummies have done those as well, so particularly on Instagram. And then, so some of the physical benefits, Dr. Moncrieff, do you want to just talk about, particularly for tummy tucks?
Yeah, so tummy tucks is a really good one, because it's not just what you see, it's also what the physical health benefits are. And I've been involved in a study Australia-wide, and basically we've found that in incontinence or leakage of urine and lower back pain is significantly improved by a tummy tuck, especially the tightening of the muscles. We also note that people's skin, in the hygiene issues that you get from skid rubbing in groin creases, is also gone because we remove all that excess lax skin. Yeah, so, you know, it's not just what they look like, it's important how you feel and, you know, your day-to-day living. If that's better, then obviously this is an operation that may suit you.
And so in terms of risk, what would you say about risk?
So look, you know, these operations are serious. So I don't want you to think that just because you can have them all over the world that these are not, you know, serious operations. We take them very seriously. We will go through all the risks of all these procedures with you, and then we'll give you some information to take home so you can go through the risk yourselves. It's an industry brochure that you can go through in your own time and look at the risks so that you feel like you're fully informed of, you know, what if anything can go wrong.
Yeah, so these are not beauty treatments, and I know that sometimes the way that they're marketed minimises that, but we do take it seriously, and you should too. In terms of cost, so one of the things that we sort of say in our practice is that Dr. Moncrieff doesn't really talk about costs. We want him focused on what your goals are, whether he can achieve them with surgery and then doing that surgery. So it is not the best use of your time to familiarise yourself with the current rebates that such and such a health fund is paying on this particular item number. But the person that we'll talk to about that predominantly will be Jess, our practice manager, and you'll get to meet her in a second when we show you the Vectra room, the simulation service that we have. So she will go through some of these things, but I'll just give you some top line kind of indications. So for an insured patient wanting a tummy tuck and a breast reduction, the total cost is from $20,000. Now, obviously, if you're having extensive lipo, that takes more time in theatre, and basically our charging is pretty simple and transparent. The longer that you spend in theatre, that means more of Dr. Moncrieff's time, more of the anaesthetist's time, more of the hospital's time. That's where the costs go up. So total cost is $20,000 for that reduction in tummy if you're covered by insurance. And again, on that article, the article that we've put up with all the case studies, at the bottom I've linked to everything. So there's the tests about whether or not you're covered for Medicare and therefore your private health insurance if you have it, or the links to those articles are all there. But uninsured, the total cost is $35,000. And we really do say that is the total cost. So that is the surgeon, the anaesthetist, the aftercare, the garment, it's everything. So again, when you're trying to compare like with like, I know that there are some surgeons that only advertise what their surgical fee is. Well, that's great, but they're not hopefully doing it, you know, in their office without an anaesthetist, all those things. So you really got to be adding up those total costs when you're looking at like with like comparison. For an org, so uninsured, which is the vast majority of breast augmentation and tummy tuck patients, the total cost is from $29,000. And again, that covers everything. That includes the implants, etc. Now, so one really important point, and I think someone's even asked this in the questions, is about combining things like arm lifts and tummy tucks or thigh lifts and tummy tucks. So from the 1st of November, the Medicare rules changed and you cannot do a thigh or arm lift with a tummy tuck. So that is really annoying, and in fact it affected one of the patients that we had booked in shortly after 1st of November, and it's meant that we've now had to stage that surgery differently. So for example, so you could still do a tummy tuck and a breast procedure, but then the arm procedure or the thigh procedure will have to be done separately. Or you could do the thighs and breasts, or arms and breasts, so those combinations, but you really can't do it now with a tummy. So that's not great, particularly for those mass weight loss patients, but it is something to be aware of. The other thing is, one of the other questions was combining surgery, does it really save any money? It's sort of yes and no. It does a little bit, but as I alluded to earlier, our costs are really just based on how much time is going to be spent in theatre. So if you have a tummy tuck and a breast reduction, it's not like Dr Moncrieff can be cutting and sewing those two areas at the same time. He's doing one and then he's doing the other. Yep. So in terms of the cost saving, look, it's minimal. It might save you $1,000 or $2,000, you know, in the scheme of $35,000 operation if you're uninsured. But the main saving is then recovery time. But again, that's a double-edged sword, because then you're trying to recover from 2 surgeries rather than 1. So I just say the cost savings is there, but you have to look at whether or not, you know, is the downtime, saving the downtime really important to you, or would you rather do it as 2 operations and just sort of recover from each individual one? Recovering from a tummy tuck, Dr Moncrieff, would you say it's a breeze?
Look, I don't think, I've never had one, but the patients tell me that, you know, it is pretty tough, especially because I really do cut out a lot of skin, because I want to get the abdomen super tight and super flat, and it means the patients are often bent over because there's, you know, they can't be upright, otherwise they pull the skull apart. And with a breast reduction, you know, it does have its, you know, impacts on people getting up back to their normal routine of life. So look, they are tough operations to recover. If you can do them at once, then look, there is benefits from doing it because you recover from each operation at the same time.
So then the next question is, you know, well then what about payment plans? So yes, we do offer payment plans in the sense that if you book your surgery in and over 6 months want to pay it off, so you can pay in regular instalments to us before your surgery, we do allow you to do that. We're not able to offer finance. There are lots of places that you can Google online, and we deal with those. We accept payments from them, but we're not personally allowed to name them and to put them on our website or anything. But obviously, you can make your own inquiries there. Superannuation is an option for mass weight loss patients, and so we do fill in those forms. It's a little bit onerous. You've got to download the form, get your GP to fill it in, bring it here. You've had your consult with Dr Moncrieff. We charge a small administration fee, and then that's sent off, and then the ATO assesses it, and then your fund decides whether or not to release it. But just keep in mind, superannuation is not free money. It's money that's intended for your retirement savings. I speak as a former superannuation advisor, and I particularly feel strongly about women having enough money in retirement. So just to understand that, you know, if there are other ways to fund it, rather than dipping into your retirement savings. But I also understand that for those patients that have had mass weight loss and that skin is really interfering with your daily life, well then you probably are better off to use that money if that's the only option that you have. Travelling for surgery. So Dr Moncrieff, in the last few months, where have we seen patients from?
So we're lucky enough to get patients all over the country. So we see people from Brisbane or from Queensland. We see people from obviously from Sydney, interstate in New South Wales, and now recently Adelaide. So we're getting people from all over the country, which is great. And you know, we get inquiries from Perth. You know, so it's great to see people travelling. I think the world's a lot smaller place, and certainly people are doing it. But we do like to see you in person, so it's very important that we do see you for a consult. I think, you know, some surgeons might do Skype and phone conversations, but I actually want to see you and physically assess you. So that's still important to us, and hopefully we'll see more and more.
Yeah, so what we actually did, because we're just getting so many inquiries, we put a page on the website. Again, that's linked in that article. And so the summary of it is, you know, you send us some photos, Jess will show Dr Moncrieff and, you know, talk about what the options are, and she will have a chat with you over the phone and then talk about coming for a consult. So all of those sort of interstate patients that we've done recently have had that consult, flown home, and then booked their surgery afterwards. So look, we're probably a little bit conservative on that, but we just think that that's in your best interest and our best interest that you've actually been assessed, you know, in person. You know, it's plastic surgery. You should be able to see what the physical symptoms are and how to address it. All right, so frequently asked questions. So that thing about, between operations, how long generally?
So certainly for when we do augmentation uplift, I like to wait 6 months at least. The scars only go white before we do the implant after lift. And generally, if people are staging surgeries, somewhere between 3 and 6 months, but look, a general of 6 months is a pretty good guide.
Yeah. So how close to goal weight should somebody be?
It's a really good question, and we get asked a lot. I really think you people should be the closest possible to the goal weight, because there's not only health effects, so complications rates go up as the BMI goes up. We definitely know that. It's been well studied and documented, but also the results are going to be so much better if I'm not having to, remove the weight through liposuction of the weight you've just put back on. So if we're starting from a very close ideal weight, then we can take more tissue off and do more to the skin than if I'm having to debulk the skin and, So yeah, I think really within sort of 5 kilos of ideal goal weight is what is suitable for me.
We want you to be stable at that weight. I mean, I think we've all gone through stages where we've dieted and we've gotten our weight a bit lower, and then 3 months later we're all heavier again. But
the weight needs to be stable.
Yeah, both of us, I think, have been through that little experience. But so the closer you are being stable for a while, the Medicare rules actually require it for things like tummy tucks, that you must have been stable for 6 months.
Yeah.
Bodies can change a lot in 6 months, so that's really important to be assessed at what is very close to what your surgical weight is going to be, and at a time that's close. And so just keep in mind that quotes are only valid for 3 months also. And the reason that we have to do that is because health fund rules change, Medicare rules change, hospital fees change. So we can only really lock it in for that amount of time. And so the closer that you are, if you want to just have a general chat about making sure you've got the right health cover and really what Medicare item numbers do you need to make sure that your fund covers that particular item, then you can have a chat to Jess about that. We do have that on each of our procedure pages. We actually have the item numbers, but you just want to be absolutely sure, because it can make a huge difference to the overall cost, obviously. So that's important. All right, so these are some of the other questions that were asked in advance, Dr. Moncrieff. Best implants on the market?
I personally have used for a very long time Mentor implants. I use the contour profile gel, which is the shaped or teardrop shaped implants, and I like them because they've got thick gel. They really help me to shape breasts well. And I think if you're, you can either consider yourself a shaper, which I think I am, or a stuffer. And look, I really like those implants and use them very successfully. But other surgeons might have used other implants, smooth rounds or other textured devices. And it really depends on the practice you have. But Mentor have a very good track record on their use, and they're a name brand and been in the market for years. And so I think you really want a product that's been around for a long time and is really, tried and tested.
So some of the other brands on the market are either very small brands or haven't been around as long, or have higher rates of complications and infections and things like that.
Yeah, but that's when, and I really think with implants you get what you pay for. And we've been very happy with Mentor, and I think it's very successful for 10 years.
You never say never, but you just don't necessarily want to be the first person to try something new. What causes rippling and how can you stop it?
Yeah, this is a good question. So we do see rippling from time to time. It's basically seen in patients who have implants placed above the muscle, because the skin layer does thin out over time, and if that patient then goes on to lose weight, especially with round implants, you can see the rippling or where the folding of the silicone implant, and it's very hard to treat. We do sometimes fat graft. You take some fat from somewhere else and try and put it between the implant and the skin so as to increase the soft tissue coverage over the implant. But it's a tricky thing. So basically, that's why I like to use dual plane, where the implant's covered by the muscle in the top half, and so that does mitigate chances of rippling. It doesn't totally eliminate it, because if people still lose lots of weight, that muscle can be thinned, and sometimes you can see rippling even through the muscle. So it is a tricky thing to do, but I think it's just really good technique, using the right implants and really making sure that people don't over-diet. It's good to be thin and trim, but you can overdo it, and when the soft tissue envelope gets too thin, you can see the lines of the silicone implant.
Another specific question, so a post-season neuroma, is it best to see a plastic surgeon, incorporate into abdo, or see a gynae for surgery?
My feeling would be really the best thing to do would be incorporate into an abdominoplasty if you're thinking about it. I think, neuroma is obviously a piece of, there's a nerve that's got scar tissue in it, and if you just remove that neuroma or that piece of nerve tissue with the tummy tuck, I think that would be my best advice to solve that problem, because trying to sort out the nerve itself, I think it'd be difficult, and it doesn't often work, and that surgery can be fraught with difficulty. So I think just remove the whole section, and then that would probably be the way to sort it.
Do you do lipectomies?
Yes, so we do. Circumferential body lifts. They're big operations. They're usually in people who've lost more than 50 kilos. Again, we just do it usually as a standalone procedure. We don't combine it with anything else because it is a big operation to recover from. We start patients on their tummy first, do all the lipo, do the back bit first, then flip them over, do all the lipo on the front, and then take the skin off. And it does obviously produce changes in the hips, the buttocks, thighs, and the abdomen, and is a great procedure, but it's something that we don't consider lightly. And the patient's got to be in good health otherwise, before we embark on such a big procedure.
And medications or supplements before surgery?
So anything really that affects people's bleeding ability. So things like fish oil, glucosamine, garlic, horseradish can also produce bruising and bleeding post-surgery. Also, anti-inflammatories also have a risk of having post-operative bleeds. But just speak to your doctor about what your medications are, your surgeon, before you embark on any surgery. And it's something that we would go through in the detailed check of your medical history as well as your medication before embarking on these surgeries.
So another lady, sounds like a very fit lady, trains with weights 4 times a week and is currently training for the marathon. How would she go having a breast or recovering from it?
Yeah, it's a tough one. We do see lots of fit patients who lift weights and run, so it's quite common. Really think for anyone doing weights or running, I really like them to have 12 weeks off, because all that arm movement like this can pull the scars, especially when they're healing. And I know that seems like a long period of time, but really you want that implant to sit in its pocket right. You don't want to tear the muscle or tear the capsule as it's forming. So I really say 12 weeks is the minimum. You might start a little bit of leg weights or a little bit of stationary bike or treadmill, maybe at 6 to 8 weeks, but nothing in the upper body to my mind sort of before 12.
Yeah, so again, we probably err on the side of being a bit cautious and conservative, but we want, it's a lot of money to spend. And
there'll be people who say you can go back to the gym earlier, but it's not worth it. It's absolutely not worth it. The effort that goes into these operations, the time, the money, things, it's just for a few extra weeks, I think you're better off just being conservative.
Yeah, and a nurse does work with patients. So as they're coming in for post-op, she talks about, okay, so you're doing really well, and what can you do additional this week? So adding on things depending on your recovery and how you're going.
Absolutely.
So, and then about reduction of scars, so minimising scars, particularly from something like a reduction.
So we get the patient seen by our clinic nurse, and she's advising people on how to tape scars. So taping scars is very helpful. Using bile oil and vitamin E supplements along the scar. It also help with the maturation of the scar. But really, pressure on scars, good silicone gel sheeting, all of those things that we talk about in some depth in the post-operative phase to get the best quality scars. But also time. Time is on your side with scars if you're otherwise fit and healthy. And we see scars that 3 months look totally different to do at 6 and at 12 and 18. So they're all things to consider, but in our practice we go through that in some detail.
So if patients are prone to scarring or have darker skin colours, you want to be more on top of it. So some of those things like the silicone-based gels can be more useful. For other patients, fairer skin patients, it really is just time looking after yourself, looking after your diet, all those sorts of things. All the boring stuff. It's not just as easy as just getting a cream, is it? All right, so before we jump in and go on to the vector, I just want to check some of those questions and just see how we're going in terms of answering them. So how long does a breast implant last?
Yeah, so that's a good question. So the implant itself really, can last sort of forever. It's just that your breast may change as you get older. It changes with pregnancy, it changes with aging. So the the implant itself may have no problems with it, you know, for 20, 25 years. Or might be in the lucky ones who might have a rupture or a rotation. So it really depends on the person and their situation. But I would say on average, I tell people, you know, you may need these replaced in 10 to 15 years. I think the time is getting longer with the new generation implants. But on average, I think when we look at people, how often we're replacing it would be somewhere in that decade to 15-year range.
All right. So how long after lots of weight loss should a person wait until they've had that surgery? So I think we've sort of addressed that. You know, the Medicare rules require it to be 6 months.
Yep.
That your weight is stable. And then it's really up to you and your budget and all that sort of thing. Sorry, people are commenting on the audio. It's just a bit hard as you're doing these things.
Yeah.
So yeah, hopefully you've got enough of the sense of what we're sort of talking about that you can address that. The discount on the second procedure. So if it's done at the same time, I think we've sort of addressed that. There is a small discount, but it's not substantial.
Yeah.
In the case of excess skin being on the belly above the navel rather than below, can the skin be just below the breast in conjunction with a breast lift? So is that asking about doing an abdominoplasty just with the scar underneath the breast?
Yes. So I would, that's what reverse abdominoplasty, and I don't think that works because gravity always tries to pull the skin down. And even if the loose skin is above it, I don't personally have much experience with it when those reverse abdominoplasties. I don't think they work. You're better off undermining all of that skin and then removing the excess by pulling it down and cutting it off, and that will pull that skin above the navel tight. And you see it all the time. People have excess not just below the navel, but they have it above it. They have it to the sides, and still doing with I think the formal lower abdominal incision still can address that laxity, because the problem is, as I said, you know, like pulling up, it may seem very good, but you can't really fix it to anything. It's not really strong. Whereas at the bottom, you can fix it to really dense, firm tissue, and I think that gives a better result.
So are outer thighs covered by Medicare following weight loss? I don't know.
No, they're not. But I have used them on occasion using a wedge number, because you know it is a wedge excision, and we've done that successfully, and you know, on people who've had, you know, liposuction already to the outer thighs, and they've still got a lot of skin, and so we have put in a lips or a wedge all the way down the outer part of the thigh, and that's been a good way of treating that excess.
What about taking Arnica before surgery?
Yeah.
Avoid bruising,
yeah,
to limit bruising.
I think other surgeons have said they've used it with good success. We don't really have any fixed views on it. I don't think, you know, the main thing is having a healthy diet and not being on medication that might make you prone to bleeding, and also careful, you know, hemostasis or coagulation of bleeding. I think they're very important. But look, I'm not really fussed on it either way. I don't think it makes a huge difference.
Those things, if it makes you feel like you're doing something for yourself to get yourself ready, then that's absolutely terrific. But the number one thing that we ask people to do is abstain from cigarette smoking and alcohol. So both those things are very bad in terms of surgical outcomes. And so they're the most important thing, and then following a healthy diet. So what's
can I have an implant with pectus secundum? Yes, so that's a very good question. We often use implants with pectus secundum because, as you know, it's where like a funnel chest or sunken chest, and what we often do is use a particular type of implant with a particular pocket to correct that kind of sunken look, and we often combine it sometimes with fat grafting to sort of basically camouflage that area. And you know, as having just a breast and body practice only, we do see quite a lot of it, and I think it's something that can be, I think, treated a lot better now with the new generation implants, oval base implants, which can basically, and done in a certain dual plane fashion, which means they can basically push the implant basically up the hill and stop them making that sunken chest look worse.
So we might take one more and then go and show the vector, and then if there's other questions we can ask those. So we want to know, lost 45 kilos, lots of skin, where do you start?
Yeah, great question. So basically, where your priorities are the highest. So is it on the arms? Is it on the belly? Is it on your thighs? And you know, we do stages operation. We've got at any one time, we've got lots of weight loss patients who might have had their first stage, and then now or might have had up to their third stage. You know, so it really depends on what is the thing that bugs you the most. And then you just start there, and we can usually do 1 or 2 operations, wait a period, 3 to 6 months, get you back, and then complete the sequence.
Yeah, so most patients would start with either their tummy or their breast.
Yep.
And so different people have different priorities with that.
Yep.
And then move on to the other areas.
Yep.
So,
arms or thighs or whatever.
But also for mass weight loss patients, it also is impacted by what their health issues are. So if they are getting those chronic skin problems, like under the flap in the abdomen, then that's the one they want to address first, even though cosmetically you might look at them and think, well, the breasts are the most urgent thing, or the arms the most urgent thing. But for them, addressing that health issue is the number one thing. So we'll just bring you in, and we'll introduce you to Jess. So we'll just go on a quick little tour. Hopefully you can still hear us. And so here she is. So Jess has actually been with us for just coming up 9 years now, Jess. So she's part of the family. Yeah, she's now a practice manager, but she does all these vector simulations. So we'll introduce you to Jess.
Hi guys, Jess here. Hope you're all loving this Facebook Live. So I'm just going to show you, this is our amazing photo room where we take all our clinical before and afters. And we also have this amazing tool, which is the vector machine, which allows patients to see what's possible before committing to surgery. So I'll do a little demo with Dr. Moncrieff now, just to give you an idea. So basically, Dr. Moncrieff stands in front of the machine, and the machine will scan him. So you don't have to put your breath into the machine; it just takes a photo. For the video purposes, Dr. Moncrieff is enclosed, so luckily.
Lucky for you guys.
And then it takes a capture, and it then uploads your photos to the computer and allows us to play with different sizing. So here you can see that's a before shot. Again, for the purpose of this video, she does have a bikini on, but before, you know, a moderate size implant and a bit bigger, so we can play around with different sizes, and we can also do lifts and small reductions as well, so you get to see what's achievable with that.
Yeah, so it doesn't show tummy tuck results. We don't actually use it for that. You technically can, but the results are not that good on the simulation. But the great thing about this is we charge $50 for it. You come in, you have the simulation, you talk to Jess about what some of the options are. Obviously, she can show you different size implants and other patients that Dr. Moncrieff has had that have a similar body type. And then if you want to continue on with that journey, that $50 just comes off his consultation fee. So, yeah, so for those patients that are determined that they want to see him regardless, well, then it's just a little value add. But for those patients that are really not sure, and I know that most clinics or many plastic surgery clinics do offer a similar sort of service. They might not sort of price it exactly the same, but it is a great way of just a bit of try before you buy. So we'll say goodbye to Jess.
Bye.
And we'll just come back. I think there's just a couple of other questions, and so we'll answer those. Sorry, just trying to walk and scroll. So yeah, so now you've done a little tour of Hunter Plastic Surgery as well. All right, so, oh, hang on. How long post brachioplasty, so that's arms, would you recommend a patient be off work for a physical job such as a nurse?
So yeah, that's a good question, and when we get asked a lot, I'd say really you need to be off for so minimum 4 weeks, because you don't want to pull those scars apart, especially lifting heavy patients or transferring patients. So I like to say 4 weeks. Longer if you can get it, but most nurses probably can get a month off. But yeah, you really want those scars to be knitted together before you start doing, you know, lifting sort of more than 5-10 kilos.
Oh, so how long should you stop drinking before surgery? Drinking alcohol?
Yeah, so that's a good question.
I assume that means having a drink before surgery.
Yeah, well, look, you know, obviously we don't want to be draconian in what we say. You can't drink alcohol. But look, I think leading up to that, the surgery, if you can sort of really go easy for the week of proceeding, because it does thin your blood out, it does make you bruise and potentially bleed after surgery. So I really like to say to people, really no drinking, you know, for 7 to 10 days beforehand, and then you can start drinking again probably in you know 2 weeks after surgery, once we know the wounds are all stable and all healed and there's no, you know, big blood clot in any sitting under the skin anywhere.
Yeah. But just sort of slowly as you come back, obviously the last thing you want to do is, you know, have a few too many and have a fall or something like that when you're recovering from surgery.
Yep.
Where do we operate?
So yes, so we operate at really 3 hospitals, but the main one for breast is at Private Hospital, just off on the Pacific Highway, just at the cinema. It's a great little boutique hospital where I do lots of my cosmetic breast surgery, and also for the bigger patients, we go down to Lingard at Merriweather, which has, you know, a longer bed stay and, you know, ICU and that type of stuff. We also work at Warners Bay for patients also maybe close to that area who also want to stay longer.
Yeah, so all when we've put that travelling for surgery page together, we've actually looked at some of the hotels that are near those different hospitals. So if it is something that you're looking at doing and, you know, your partner or a friend is coming to support you, they can be staying there, you know, while you're in hospital, or if it's just a day stay, that you might want to stay out the night before and then in recovery. And we talk about how long we'd ask you to stay in Newcastle. We don't want someone getting on a plane the following day.
No.
So, you know, those sorts of things. Boob breed. So do patients wish they'd gone bigger? Is there much difference in a 50cc implant size?
That's a good question. You know, we do see this from time to time. You know, that patients obviously wish they'd gone a little bit bigger. And it's hard to know, you know, for some people, just getting a gauge of what they want out of the procedure. But yeah, we do see it from time to time. But you know, implants go up usually of increments of somewhere. The ones I use between 45 and 30 cc. So, you know, 50 cc's is not a big increase. And if someone was coming back and said, look, I wish I'd gone bigger, we wouldn't be advocating a 50 cc change. I'd be saying more like 100, 150. So they got, you know, a noticeable difference. And you won't see a huge difference in 50 cc's. But it is quite common, you know, probably. The studies show 15% of people, if they audit them, probably wish they thought they could have gone a bit bigger. But at the same time, there's a big cohort of people who don't want to be too big. They don't want to have that operated look. So it is a fine balance.
And the good thing about having the vector simulation is that you're going to be able to see some of this. I think the great thing about vector is it gives you an idea. I think most of our patients say in real life it ends up actually looking even better. But it just gives you that idea. And obviously we've got the physical implant, so, you know, you can pop one into sort of a stretchy sports bra and to try it on. We do get the odd patient that says, I wish I'd gone bigger. We don't get that many that say they wish they'd gone smaller. But I think since we got the Vectra, you know, a few years ago, the numbers of people that are not satisfied with their size has really dropped. You've got to keep in mind 50 cc's is, you know, a very small amount. You know, a lot of people will agonise and be doing so much research, and I'm constantly responding to people on Instagram about, you know, people are like, what size is this? What size is this? What size is this? And I'm like, it will just, how it will look on your body is so different. And the difference between a 375 and a 425, really 50 cc's, it's 50 mils. So, you know, it is really not much liquid you know, at all. So yeah, so I think people agonise about it sometimes, perhaps a little unnecessarily. You know, one of the things that Dr Moncrieff does, which is probably a little bit unusual, I think plastic surgeons do it, cosmetic surgeons tend not to, because they're all about getting a patient out of the theatre as fast as possible, is to use sizes. So
they're critical. I think you know, anyone who's doing has a fairly large volume augmentation practice, sizes are very important, because you can simulate what someone's going to be like, you know, before, you know, when they walk out of that hospital, and you get an idea of what that size is going to look in that person. So we organise a range of sizes. We sit the patient up, they're asleep, and we can have a pretty good idea of what that implant's going to look like in that person.
Yeah, so that happens during the operation. So those sterile sizes are actually inserted, and Dr Moncrieff can actually have a look, see whether it actually meets what the patient asked for. So a patient that wants a more natural look will be different from someone that wants a really augmented look, but at least he can say, okay, I think we've achieved it with this size before we put the definitive implant in. Other surgeons will say, this is the size you're getting, and that's the end of the conversation, whether it looks good on the table or not. So that's one of the things that makes us a bit different. All right, so I think that's the end. Oh, sorry. Does a tummy tuck lift the mons area, or is it done separately?
Another very good question, Tegan. So we do that as part of the procedure. We do a mons lift, and I actually spend time actually debulking the mons. Some of the monses can be quite big. You know, they can get that fatty layer underneath them, and we do a number of steps to get that area down, because when you join the skin that's been thinned out, so it's gone from this thickness down to this, and you've got a big bulky mons, it looks like there's a hollow or a depression. And so we spend time trying to get them even. And that means taking fat out underneath, as well as taking skin out and bringing that up to meet the abdominal skin. So most people do get a mons lift with a tummy tuck.
I think there's still quite a lot of people on. We've gone for an hour. We're happy to keep answering the questions, so we'll just try and get through the last few, but we do understand if you need to go. Probably everyone's thinking about big time for kids soon, or certainly for those of us on the eastern seaboard. So for revisions, is the cost less than the original procedure? And what's your revision rate with procedures in general?
So revisions unfortunately are actually more expensive than the original procedure, and the reason for that is it's actually always harder. If it's revising your own work or somebody else's, the procedure itself is usually is more deep. There's more detail in it. There's other things to consider. So, and they tend to take longer. And as Amber was saying, it's a time-based pricing, then it tends to go on for longer, and so ends up being more. So for that reason, the costs, revision costs are generally greater than what the original procedure was. Our revision rate is low, thankfully, because we do take the time to get things right. But of course, it's not going to be zero. Every year we would spend, probably be doing somewhere between 6 and 12 across the practice revisions, whether they be for breast implant or tidying up a scar in a breast reduction or something minor. Everybody has them, and if you're doing enough of this work, you're going to get them. And sometimes you just got to, we just have to wear it because the patients have paid a lot of money, and we want to provide value for people. And it's something that we can fix easily, then we tend to look after it.
About breast implant revisions. So you should just be aware too that again from the 1st of November last year, new rules kicked in about removal and replacement. The rule was always, if you're removing and replacing because they're clinical needs, so not I don't like the size and I want to go up 100, but if there was a problem with the breast implant, you could use that item number, which then you get a small rebate from Medicare, but of course the bigger thing is that your private health insurance covers that. That is not the case anymore unless you can show in the operation that Dr Moncrieff can take a photo to say that you would have a deformity if a new implant wasn't placed in there. So that is a much harder test. They're saying really that laying down you'd need actually a cavity to be created to warrant it. It means that what we're doing now is up front we can't give people item numbers. Look, I know surgeons are still doing it. Again, we're conservative. We don't want a situation where people are then being told no by Medicare and their health fund, and then the hospital's chasing them and all that sort of stuff. We'd rather say up front, we're not giving the item number and it's fully uninsured. And then if Dr Moncrieff is able to demonstrate it, obviously he will, and therefore you can then make the claim. But yeah, just be aware that it is much more expensive now to have a removal and replacement than it is a primary org. So with Dr Moncrieff, we start at $10,500. You're having an anatomical implant, you want to stay in overnight, well then that's an extra sort of $1,000. So you're looking at say 11.5 with all the bells and whistles. However, if you are looking at a uninsured, so you were not able to give that Medicare item number replacement, then you're looking at about $18,000. So it is substantial, and I think the days of people just saying, oh, I'm going to get it done cheap in Thailand and I'll get it fixed back in Australia, you're kidding yourself if you think that's an option. And then in terms of revisions that Dr Moncrieff was talking about, obviously if it's our own patients, we try and take care of that and use health funds and all those sorts of things. But if it's another surgeon's operation, it's very hard for Dr Moncrieff, even with file notes, which many of them don't come with, to know exactly what's happened. So I just say, look, there are lots of great plastic surgeons out there. We've put the detail for the Australasian Society of Aesthetic Plastic Surgeons, of which Dr Moncrieff is a member, and that's got aesthetically focused plastic surgeons on it. I've put the link on that web page as well. So, anyone with a basic medical degree can call themselves a cosmetic surgeon. So many people still don't understand that. I know lots of people on this page do, but you've just got to find someone, at least put one proper plastic surgeon in the mix when you're looking at your options. Are we done? This is a funny question. Oh, thanks, Monique. Thanks for that nice feedback. Rebecca, this is a question we were talking about today. So we're talking about our post-op notes and whether, so her question was about removing nail polish for surgery. And what did we agree on?
One available for the pulse oximeter to monitor the blood oxygen saturations. But otherwise they're all
so a lot of our patients have acrylic nails or sort of similar and don't want to remove them. Sometimes the hospitals don't mind and sometimes they do. As a general rule, they'll say if you can just have one digit available. I know that doesn't look aesthetically that nice, but you just want to be, look, I always think of these things, they're on the side of caution. So if that's what they ask for, and yeah, general nail polish, obviously, if you can just remove one, that would be great. Thanks for taking time out of the family. That's not a problem. Looking at getting breast reduction. History of keloid scarring from previous orthopedic surgery. What's the chance of keloid scarring with a plastic surgery?
So good question, Megan, around some, we get asked that quite a lot. So it really depends on where the keloid scarring is. If it's on the shoulder, keloid scarring is very, very common. So there is a triangle between one shoulder, the second shoulder, and your breastbone, where keloid scarring can be in that sort of upper chest area and shoulder area where there's a lot of movement where keloid scarring is common. Breast reduction surgery doesn't tend to have very bad scars, and the scars, if you follow these patients sort of up to the 18-month post-surgery, often very, very good. You can hardly see the scars. But obviously, if you've got dark skin or Asian skin, or have a connective tissue problem, then we often do take more precautions with your skin and do some slightly different things. But look, most people, if you're a Caucasian of Caucasian ethnicity, will really not have too many problems, despite the fact that you might have had bad scars elsewhere.
Yeah, so particularly, I imagine if it was an orthopedic one, it's probably in an area that has a fair bit of movement.
That's right.
And movement is not good for scars. So, all right, so how long is the wait list for surgery? How long after weight loss would you recommend before waiting? So we've sort of talked about that. You want to really be stable for 6 months. That's how you get that box ticked for Medicare.
Yep.
But also just for yourself, I know my weight goes up and down. I know Dr. Moncrieff's weight goes up and down. So you really want to be stable at that point where you're comfortable keeping it. I think most people on their weight loss journey tend to err on the side of too thin and then put a little bit of weight back on, and you really want it at that stable weight for 6 months. Is there a long wait list for surgery? It varies. Obviously, at the back end of the year, if not a great time. So you really want to be sort of starting to at least talk to us probably 6 months in advance. The peak times often tend to be around school holidays because that's when people can get time off. This time of the year, so I think it takes about 4 to 6 weeks to get in with Dr. Moncrieff. If you see Jess for a Vectra breast surgery simulation, she can use a fast track appointment because she's already seen you. And then for surgery, again, it just depends on what you're having. If you're having a mummy makeover and we need an entire operating list just for you, then that just depends on how many of those. We don't have that many of those, available where we haven't already booked, say, like a reduction on, and we don't want to have multiple surgeries on when we're just focusing on you for a whole day. So, that sometimes that lead time will blow out, and we know that at the end of the year, everyone wants everything done before Christmas. To be honest, the best time to have a mummy makeover is in the cooler months.
Yeah. So look, if you think about it, you can just come to consult, and you can set the train in motion if you like to get this surgery planned. And just seeing someone doesn't hurt, because then you've got some information and you can go away and think about and see when the right time is for you. But certainly cooler months are better because of the garments.
Yeah, so keep in mind that mummy makeover kind of thing, you're going to have a garment on your breast and you're going to have a garment on your abdomen, and that goes from sort of right up under your breast. It's like a little pair of Spanx. I'll be honest and say that the patients that had it done at the end of last year that have endured the heat wave in the eastern seaboard, they would not have wanted to have done that without a lot of air conditioning. So winter is a much easier time in terms of that recovery, particularly if you're not someone that has a really good aircon system. All right, so I think that might be it. Yeah, thanks so much, guys. So look, we've gone an hour and 10 minutes. I hope that's answered a lot of the questions that you have, and we're very happy to answer additional questions. You get on our website, have a look at those case studies from tonight, send us a message at the bottom of that page, and Jess can give you a call if you've got questions about, you know, staging surgery and costs and all that sort of thing. But otherwise, yeah, thanks very much for joining us.
Yeah, thanks for watching. I know it went long and there's a lot of information, but we appreciate you taking time out of your families and your lives to watch this, because you know,
yeah. All right. Thanks, everyone.